There are lots of different reasons people consider home care, but the overlying reason usually is personal dignity and freedom for the person receiving care, and this is so important. We in private home care have been looking after people in their own homes for over 24 years now, so we have a wealth of experience, and because of this we would have quite a number of our services on our website. Now, of course, each service that's on the website may not be exactly what you would want, so we can tailor make every service that you require. Well, every family is completely different, and what is suitable for one person and one family may be completely unsuitable for another. So really I would just go with the flow to a large extent, always making sure there's empathy and sensitivity for the person who's going to require the care. You have to look after their needs. Remember that 30 years ago, this elderly person was probably looking after you. The role is now completely changed, and you're now looking after this elderly person. That can be very daunting, can be very difficult for people, and this takes time to readjust to the new roles, but it can be achieved, and it's not something that people should be worried about. They are doing the best for their elderly relative. When it gets to the older person themselves, I would always encourage the older person to try and verbalise that they need care, and not that care is pushed upon them. You often have breakdown in care when that happens. So again, just to emphasise, if the person is able to choose their own care, encourage them to do that. Now, there is the other side of the coin there where maybe there's confusion, and that can be very difficult as well, and there are little tricks on how to manage these things, and I would always encourage families to get together and to agree the course of action for care. This sometimes can cause conflict amongst the family members, and this is not unusual. So again, we are very, very happy to guide you through that. It's not that we're chairing meetings, but we can gently guide people through those meetings, and are very, very happy to do that. And the outcome usually is very, very successful. Well, there are many elements to the team in private home care. We have nurse managers, we have client managers, and we have client administrators, and they support the clients in their own home. We pride ourselves that we supply a client administrator to each client, and that's their individual client administrator. So they get to know everybody very, very well. You can always talk to these client administrators. You'll be introduced to them at the very, very beginning, and they look after your care plan. They introduce you to the carers, or in the case of nurses, they introduce you to the nurses. The nurse managers call to your home, and they're always on hand if you've got any worries or concern. And our client manager then manages the client administrators. She's mainly office based, but she also will call out to you in your own home. So our compliance and HR staff, they look after all of the nurses and carers, and this is from the time we begin recruitment to the time they're set up and on our files. Each nurse or carer will be Garda vetted. They'll have all the references checked. We have face-to-face interviews with absolutely everybody. We follow a very, very strict criteria. The educational qualifications of carers and nurses, nurses are all registered. Carers will be working, they may have FETAC level 5, or they will be working towards FETAC level 5. Now, these are minimum educational qualifications. Many of the staff who are attached to private home care have additional qualifications. So there's no need to worry about the background of these people. You can always choose. If you find that you would prefer a different carer, this is not a problem for private home care. We can organise that for you, and that's all done in confidentiality. Private home care, we pay our carers and nurses, and we also insure them. If you have any query whatsoever, we are always there to help you with that query. We have ISO 9001, and again, we've had this for many, many years, and we are delighted to have this award. We provide a 24-hour service on-call service, so you can be reassured that there is somebody always there to take your call, whatever time of day or night. As the founder of Private Home Care, I'm very proud of the job we do. We recognise that each of our clients have personal needs, and we try our best to meet these needs to the best of our ability.